Hi everyone, it's Aunt T. Today was rough. I typically take my dad to the store, and I take the teenager to summer camp, and then I pick my dad back up from the store after he grabs his groceries. So I got there to pick him up, and he came out, and he was very, very pale, and you could tell he was just very confused, and he was clammy, and he didn't feel good, and I grabbed the cart and I got him in the truck, and he didn't have the strength to put his seatbelt on, and I said, Dad, I'm taking you to the hospital. So I took him to the urgent care that was closest to the store, and he went in, and something was wrong. I don't know. He just was so, he said, on a scale of 1 to 10, it was like an 8. He felt so bad. So he went to the restroom. I helped him there. We got him back. The nurse brought him back to the room, and they immediately called an ambulance to come and get him, to take him to the emergency room. And his blood pressure was like 84 over 54 or something like that. And he just couldn't really articulate very well. He was, again, he was really clammy, and there was something wrong, but couldn't tell. They got him on the bed from the wheelchair that I had borrowed to get him into the building, and he started feeling a little better, and his blood pressure went up to like 100 over 60 or something, which is more normal. They did the 12 lead EKG and just found his normal AFib, which is standard. But they wanted him to go to the ER. So he goes to the ER. I'm following. And they get to the ER, and I go into the hospital emergency department, and I tell them I'm there. Now, my dad has a cochlear, and he's very hard of hearing. He has real trouble communicating with most people because he can't hear. So I tell them I'm there. They say, well, we're going to triage him. They'll come out and get you if they need you. And I said, well, he has trouble. And she was very kind of curt. And I thought, okay, I'm going to just let it go. And I sat down. About 10 minutes later, they wheel my dad out into the waiting room of the emergency room in a gown. His IV was already started, but they weren't doing a drip. And he proceeds to sit in this gown in a wheelchair, trying to sleep for 2 hours. And they kept bringing patients out into the waiting, just into the lobby of the ED, and letting them sit there. Just sit. All these people. Some people with nobody there with them. People that were really sick. There were people there with, what looked like maybe cellulitis on their legs, or just so many people just sitting there in the morning on a Wednesday. And there was no treatment plan. There was no care involved. It was like just diagnostics. Like, well, we'll pull labs and we'll do this, but we're not talking to them like they're people. They're just nothing. They treated everyone, including my dad, like he didn't matter. And it hurt my feelings because he was sitting there and he was so tired. He just wanted to take a nap. They didn't even put him in a gurney on the hallway. They just left him in this wheelchair, and he tucked his head down on his chest, and he slept as best he could for 2 hours. And then across from me, I see this gentleman who walks down from the inside of the hospital to people who are waiting. And he's addressing these folks, and he says, you might want to just call your regular doctor because you may not be seen for hours. And in the interim, I'm just looking at my father who is clearly exhausted and something's going on, but nobody's telling us. And I pull up his portal and I look at his labs, and almost everything is normal. There's a few things out of whack, but his EKG came back fine. All of these things are fine. So we're going to go home because this is not doing him any good. Just sitting here waiting. And I have never, ever left a hospital like that. Never. And I would never if I thought they were helping him, but it did not feel like they cared at all. And I've been in health technology for over 20 years trying to improve care for patients. And it seems like it's getting worse. And it doesn't feel good to watch that happen. I don't know if I'm going to post this video or not, but I need to say that this is not okay. How we're treating people is not okay. You know, I wish Dr. Beachgem or Dr. Tommy would say something about how they keep going, even when it looks like healthcare is getting worse instead of better for people. Like, we don't treat our elderly worth anything. We don't respect them at all in healthcare, and I don't understand why. You know, I don't understand. Veterans don't get great care unless they have like a lot of people advocating for them. Elderly people don't get great care unless they have a lot of people advocating for them. But there's a whole lot of people in this world that don't have somebody like me who's willing to say, no, this is unacceptable. You have to do better. It's so frustrating. I got him in the truck and I called his doctor immediately and I said, look, please look at his labs because I'm not going back to this emergency room ever. This is the second time for him and there was twice for my mom, and they didn't do a good job with any of it. And I just don't know how it's acceptable. I don't know how it's acceptable that we spend over $12,000 per patient, per person in this country. Every man, woman, and child, an average of $12,000 a year is spent on healthcare. And we don't have better outcomes than any industrialized country, hardly at all. So how is it that we're spending more than any other country, but our outcomes still aren't great? This is an example of why they're not great, because we forgot to keep the human in humanity. We don't treat people like people, we're treating them like cattle. Like, he went there because another facility sent him there because they thought he was sick enough. I didn't take him there myself. Another care provider, another F&P or PA or doctor looked at him and said, he's too sick to be here. We got to get him over to a better facility. It wasn't a better facility at all. It was awful. It was awful. And it was unacceptable. And I don't know. I don't know. I just don't know. I checked on him tonight, a little while ago, and he said he's feeling better. We don't know what happened. We don't know why he got so sick. We don't know why his blood pressure dropped. I have no answers. I'm assuming it's a vasovagal response to him walking around Walmart. That's what I'm going to attribute it to, but I don't know. But at the end of the day, we have got to do better at taking care of our elderly, and our veterans. I don't understand. I don't understand what's happening. I really don't. But it's tragic. And I would love for people in the medical field to explain to me how they continue to stay in a profession that sometimes must feel like it's, I don't know, change isn't really going to happen, I guess. I've been doing health record implementations for over 20 years, and I always believed that it was making a difference. I always believed that health outcomes would get better. But now I'm starting to question my entire career, because today, I don't think care's getting any better. And if he didn't have me there, I don't know what would have happened. And that sucks. Anyway, take care. I'll see you soon.